So I'm going to give a few introductory remarks. As Steve said, in this workshop we have been considering issues, ethical issues, oversight issues related to research involving standard of care interventions. And we designed the workshop to have three major sessions that deal with three major themes. And yesterday we began with a discussion about randomization of participants, followed by a session about determining risks and specifically trying to discuss a bit the notion of reasonably foreseeable risk. And this morning we're going to continue with the third panel, which is to frame risks of standard of care interventions. What should the consent form say? And in doing this, our panelists, our presenters and panelists will have the following session objectives. One is to outline and discuss differences associated with receiving standard of care interventions in a clinical setting versus in a research setting. So this is an issue that we had started to actually discuss a bit yesterday because it seems to be really critical to this discussion about how we look at standard of care interventions. And so in doing so, we will discuss the risks and potential benefits of standard of care interventions and whether those risks differ depending on whether they are received in a purely therapeutic clinical setting versus in a research trial or in a research study. To consider how risk and potential benefit of standard of care interventions are communicated to patients in clinical practice versus when patients are subjects in a research setting, and how these differences affect the consent process, the clinical consent process as well as the research consent process, to discuss the implications for the review, conduct, and oversight of research studying standard of care interventions, and to discuss what should be considered risks of research. And we would like to do all of this within the context, just remembering that there is draft guidance, and so we want to be thinking about what it means in terms of the draft guidance and formulate some comments specifically that might address some of the questions in the draft guidance. Just a reminder that, as we said yesterday, we will continue the tradition today that this workshop is about discussing standard of care research. It is not a re-examination of the support trial, that one study that we do not mention by name. And so I would ask the presenters and panelists to just follow that practice that we had yesterday. And so with that, we would like to begin with our first presenter, who is Andy Bertolatis. He is an associate professor of internal medicine and an IRB chair at the University of Iowa. And the title of his presentation is Distinguishing Risks of Research from Risks in Therapeutic Clinical Practice.